Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita.
Ron is with his family this afternoon, and I'm Jean Marie.
Collectively, we are the hosts of PodcastDX. On today's show, we're talking with author, speaker, and licensed clinical social worker, Sherry Botwin. Sherry has been practicing since 1996 and is a certified trauma expert treating those with eating disorders, anxiety, depression, and trauma. She's here today to talk about her work helping individuals recover from childhood trauma. Hello, Sherry, and thank you for taking the time to join us.
Thank you for having me.
We're glad you're here. Hi, Sherry. This is Jean Marie.
Hi there.
Hi. What inspired you to pursue a career as a social worker?
So when I went to college, I majored in psychology, and at that time I wasn't really sure what exactly I wanted to do. So I decided to go to school for my master's in social work, thinking maybe I could work in the schools or maybe I can work in the community. So when I first went into social work, I wasn't really sure how I was going to use the degree, but I was told by many people, if you go for your master's in social work, it gives you the opportunity to work in a variety of settings. So that's what I ended up doing.
Okay.
Well, that's a good...
And it sounds like you wanted to help people from the very beginning.
I definitely wanted to help people, but I think I really thought I was going to work in the schools because I thought I was going to be working with other teenagers or children. So that part, I think I wasn't sure about, but I have no regrets, and I'm so glad that I went for my master's in social work because it really was the stepping stone to me finding my place in the psychology field.
Mm-hmm.
Okay. And what's the difference between a therapist and a licensed clinical social worker?
That's a good question. So people who say that they're a therapist can be anybody who went to school and got a master's in whether it's social work, counseling, marriage and family practice. So for me, the licensed clinical social worker piece is I've already gotten my master's in social work, but that C in my credential, the clinical piece, what happened was after I got my master's, I needed to go into the field and work for a couple of years in a clinical setting and be supervised by an LCSW. So there's not that much difference between being a therapist and an LCSW. A lot of times, licensed clinical social workers, we call ourselves therapists if we work in private practice and we see people in our offices doing individual, family, or group work.
Okay. And it sounds like you have you've earned the right to call yourself a licensed clinical social worker because you have the education and the experience behind you, which is wonderful. It gives you,
Yes.
yeah, okay. And how can childhood trauma lead to mental and physical health issues in adulthood?
So what happens for people when they go through different types of trauma in whether it's childhood or early adulthood, if they don't have a place to go to talk about what happened, if there's not a place where they can go and process all those emotions that we keep in from the different experiences we have end up going into our bodies. So what happens is people with trauma histories are walking around with a lot of feelings of guilt, shame, a lot of grief and loss, a lot of anger. And what happens is we store all that in our bodies. And what happens for a lot of people is they end up developing things like depression, eating disorders, post-traumatic stress disorder. I was just talking to somebody before this that struggles with a lot of physical pain because of all the anger and the shame that person has buried in their body. So the way I understand it, after having gone through my own process of really working through trauma, is our bodies are sort of like the containers for all the emotions that have not been talked about, not been addressed, and haven't been understood.
Okay. And what inspired you to write Stolen Childhoods and Thriving After Trauma, Stories of Living and Healing?
So I really wanted to write a book from early in my recovery because there's so many things that happen when somebody starts dealing with trauma as adults that I think most people really don't understand, including a lot of therapists who are not trained with trauma backgrounds. I really wanted to put the message out there that there are ways that we can work through and heal from whatever the trauma is.
Hmm.
I think it's important that people understand that there's a whole process that comes in the aftermath of going through awful life experiences. But to be able to explain, especially in this last book, Stolen Childhoods, which actually just came out on Tuesday, to be able to really talk to survivors and help them understand the steps that people can take when they're trying to wrap their heads around what happened to them and trying to live with so many feelings that never got dealt with, so many memories, flashbacks. So, really, just to get the message out about the hope that comes from understanding and acknowledging what happened to us and different ways people can then face their trauma and learn how to live a life that maybe they've been struggling to live because they're stuck in the guilt or the shame.
Sure. And one thing that the reason why we do this podcast is hearing someone else's story and realizing that you're not alone can be huge. And it's wonderful that you've included that in your book, and that um, thank you for for putting all the effort and work into writing that book. Can you give us like a little preview and let us know what are some of the steps one can take to help recover from childhood trauma?
I mean, the first step I think is to let ourselves know the truth, to decide at some point in our lives that we are still here, we survived whatever we survived, and now we need to be able to acknowledge it and face it. It's really important to have different support systems where we can begin to talk about it and tell our story, because I think a big part for childhood trauma survivors is things will happen to us, but we're not telling people. So we have all these different experiences or stories that get left sort of sitting inside of us, like we're sort of keeping secrets.
Hmm.
So I think really that's the most important piece, is to learn how to integrate and accept the idea that yes, these things happen to us. There are things that we can do about it. We don't have to do it by ourselves. We can go to therapy, we can join support groups, we can read books, whatever, feels right for each particular person. But
Hmm.
I think people, when they think of childhood trauma, a lot of people don't even want to talk about it because it just feels too big, it's too overwhelming. And I understand that feeling, but I think to be able to understand that when we feel overwhelmed, if we take steps, if we take action to deal with all those things that are overwhelming us, we won't always feel the way we feel in our lives when we're keeping everything to ourselves.
Okay. And when should someone seek professional help in their recovery process and recovering
Yeah.
from childhood trauma?
So, what I say to people is if whatever you have survived is interfering in your ability to function, whether it's at
Mhm.
work, in your relationships, or even your relationship with yourself, many of the clients that I work with have been battling with eating disorders, depression, drug addictions, different types of self destructive mechanisms that really don't allow us to live in a healthy body. And these things don't really allow us to have healthy connections with others.
Mhm.
So if you find that you're spending most of your day or life beating yourself up, sabotaging things that could make you successful, pushing people away that you really don't want to push away, those are all signals that you might want to go to therapy and get some help.
Okay. Thank you.
And how could a friend or a family member support the recovery journey for somebody that's recovering from childhood trauma?
So I think it's very difficult for some people, as survivors, it's hard to find friends that can tolerate and accept what we may be going through. What I always say to people who are trying to support loved ones is you don't have to be a trauma survivor to be there for your friend or your family member. If you are willing to listen and you are willing to be present as a witness, and if you understand that it's not your job to try and fix it, it's really just your job to support your loved one and say, it's going to be okay. I don't think differently of you. I know this is really hard. And even to ask your loved one, what are some things I can do to make you feel less alone? So it's definitely not a supporter's job to try and fix it
Okay.
or make it not so. It's
Hmm.
really just knowing I have friends that accept me for who I am, even if they don't really understand what it's like for me, just to know that there's people who believe in me, who stand by me, who can tolerate the difficult feelings that sometimes can come up in the relationship. Those are things that make support people supporters and really
Hmm.
loved ones and helpful in the process.
Okay. And Sherry, with the increased stressors and changes in the world today, what can parents, educators, and the community do to help foster resiliency in children?
I think the most important thing that we can do for our children is be open to hearing what they have to say, to encouraging them to not keep things to themselves, to really say to children, listen, we live in a crazy world. There's so much going on here in other parts of the world. You can talk to me about it. You can tell me what you think. You can ask me questions. I think it's really important too to reassure our children that's even when we feel like we live in an unsafe world,
Hmm.
we can do things to make them feel safe in their experience, in their setting. I think that's really important because I think kids are constantly sort of looking over their shoulder waiting for the next bad thing to happen,
Right.
and I think some of that is a result of all the attention that social media brings to those bad things. So to really let children know, you can be children. You don't have to always be worrying. We are doing what we can to make sure you're safe. And really just to say to children, if there's something wrong or if something is happening that you think shouldn't be happening, don't keep that to yourself. Tell me or tell somebody.
Hmm.
I'm just, this is a side question that was not in the script, but do you believe that childhood bullying can be considered a childhood trauma also?
Absolutely. Because what happens when a kid is being bullied is they're left feeling ostracized, stranded, they're left feeling unsafe and feeling like they're by themselves in this world. Those are the same feelings that people that I work with who are adults describe feeling when they've been abused by adults or when they've survived combat or when they've lost a family member suddenly. So it is very serious, and left unaddressed can lead to very similar consequences as any other type of trauma that I've talked about in either of the books.
Okay.
Okay.
All right. Yeah, I mean, that's so prevalent in society
Hmm.
now. It's like you
Well,
almost kind of
there's a lot that children today are contending with on a day-to-day basis
right,
that
right.
we didn't really have to deal with at
No,
all.
I mean,
We had a pretty, easy time of it in
yeah,
comparison.
yeah.
Sherry, how can talking with children, as you've said many times, talking is vital, but talking with children about their emotions and responses or reactions help prepare them to cope with stressful or uncomfortable situations?
So I think what happens when we're talking to children is that we're teaching them how to deal with their feelings, especially
Okay.
the ones that most of us don't want to have to feel, whether it's anger, sadness, disappointment. So what we're doing is we're helping them develop tools and strategies to really feel a sense of themselves and know that they can get through difficult experiences. When we foster that type of esteem in children, it makes their life challenges moving forward easier to deal with.
Okay. And I know something I've noticed with my nephews who are now all young adults is that um, they definitely, as children, they're so observant and they pick up on things. So when the adults around them are going, feeling emotions and expressing themselves, either in positive or possibly, less positive ways, they are internalizing that and processing it. And then you see as adults how they are like little mirrors, little reflections of everything that you've done when they were a child. For example, my one nephew, I said something like, I said, "Oh, I hate that," and he just looked at me. He goes, "Hate is such a strong word. Do you really mean that you hate it?" And I was just like, "Oh, I pictured this guy. I was like, I remember this conversation when he was little, and now he's coming right back with it." So it's just,
Yep.
it's amazing um, how much of an influence
They're little
adults, yeah,
sponges.
how much of an influence adults can have. Um,
And they're watching us very closely, but they're also watching the adults that they're seeing on social media and
oh,
how they're
yeah.
behaving. They're watching their teachers, they're watching their friends' parents. So I think that, we live in a world now where you can't really get away with much of anything without
Hmm.
somebody hearing or knowing what you just did or said.
Hmm.
So to really be mindful of that. And
Okay.
also, as adults too, what I say is, we are people, we are not perfect. So if
Hmm.
we do say something and think, oh, I don't think that was something I would want my kid to hear, it's okay to go back and say, that wasn't really a good moment for me. So I know that you heard me say that, but it wouldn't be how I would recommend that you talk. And it's something that, that in that moment, I wished I hadn't have said that.
Oh, that's great
Or I wish I
advice.
said it in a
Right.
different way.
Right,
Okay.
right. I mean, and to let the children know that adults have flaws
And we're
also,
working, yeah,
and
we're
we're
working
working
on it.
through ours. So
Right. And I guess that's another reason to seek out assistance
right,
is, so that you are able to recognize those issues and
right.
address them.
Sherry,
Right.
what's next for you, and what are you looking forward to accomplishing in 2024?
So I guess what's next for me is
Hmm.
happening now. So my third book, Stolen Childhoods, just came out on Tuesday. So in the next several weeks, I'll be going on a bunch of different interviews and just really getting the word out there about the book. I'm also serving as an expert witness in different cases, civil and criminal. So I have that going on, and I'm just started also serving as a guest contributor on the Law and Crime Network. So on that channel, I have already started, but I'm going to continue to comment on some of the cases that we're hearing about in the media right now. So I think what's next for me is what is always happening in the moment. Like, I try to seize the opportunity and use my voice in a multitude of platforms to try to just get out there and really spread messages of hope and healing.
Excellent.
Yeah,
Thank
thank
you.
you. And
And how can our listeners get their copy of your new book, Stolen Childhoods and Thriving After Trauma, Stories of Living and Healing, and also learn more about you, your social media accounts, or wherever they can find you?
They can definitely find me on my website, which is just my name, sherrybotwin.com. They can find me, my books are on Amazon, and starting in June, my book is also going to be released as an audio book, which I very happily and thankfully had the opportunity to narrate the book myself, which was
Oh,
super
nice.
exciting.
yeah,
Nice.
So
that's very
that'll
exciting.
be out on Audible. I'm of course on Facebook. I'm on Instagram, LinkedIn. So if you type in my name, Sherry Botwin, you should be able to find me on a variety of social media accounts.
Excellent.
Okay. And
I
yeah,
can put links for all that on the page that we dedicate to this episode.
yeah, that would be great.
And we want to thank you for joining us today. If any of our listeners have questions or comments related to today's show, you can contact us at podcastdx@yahoo.com, through our website, podcastdx.com. And we're also on Facebook, TikTok, YouTube, Pinterest, and Instagram.
Yeah, thank you, Sherry. I know we saw your books on Amazon, and they're very easy to get because you can download them today on Kindle, so that you can
Mm.
have them without even the wait. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something you heard on this podcast.
Till next week.